Hi guys, I am going to walk you through your appraisal of systematic review. What I have in front of me is actually the outline that you can utilize, and I prefer you to utilize to complete your systematic review that is due at the end of the week. Now, essentially what you're going to do is remove the information under the headings and then input your information within these. I think it's pretty self-explanatory from this point. Just make sure to read the information and to make sure you're addressing all points like this. And here there are 4 points I want you to look at. You're familiar with search strategy, and then since you're not putting your own, you're putting what the author actually did in the article. Same for the rest of these. Now, here are some new terms that you've learned this week. I did provide 2 slide decks and a video to help you better understand these new definitions and what they are and what they entail. You have your main findings, your synopsis. Please note that I do want it to be 200 to 300 words. Then you're going to do implications for patients. Essentially here, I want you to think about how would you take the information that you've read on, learned about, and processed and explain that to a patient, and is it beneficial for a patient? Essentially what we're doing is we're taking this research and we're figuring out how to apply it to your clinical practice. As clinicians, having done the research, now how would you explain that to a patient? With that being said, make sure you're keeping it in terms that they can relate to and in a conversation that they can understand. They won't always understand the technical terms that you're used to as a clinician. So make sure when you're putting your response in this section, you're thinking in the terms of actually speaking to a patient. Last but not least, make sure to include your references, and this entire document should be in APA format. Now, one more thing I would like to show you is this critical appraisal checklist that I've provided. This is just a quick checklist. This is not something you have to turn in. It's more of a guide. Use it as a guide to kind of help you walk through the actual assignment, and then for your discussion questions where you're going to pick your own systematic review. There are a few questions that you're going to look at, and this should pretty much help you walk through it. Okay, again, I think this is pretty self-explanatory, but if you have further questions on it, please don't hesitate to ask. Also, what I like about this document is at the very end, if you need a recap on some definitions or what things are, there is a small section here that provides those definitions for you. One thing I would like to note for your discussion questions is that you do have 2. I'm not asking you to spend night and day on picking the best systematic review. I essentially want to get you back in the groove of searching for articles, and make sure to use the Cochrane collaboration because that's a large database with systematic reviews, and you're sure to find something that you're interested in. So essentially just find a systematic review that you're interested in and then complete the discussion questions. The first one is going to ask you to pretty much outline your systematic review, and then your second discussion question is going to ask you to look at the forest plot. So make sure you do pick a systematic review with a forest plot. Essentially all I want you to do is give me a summary of what is it stating, what is going on in this visual presentation. I just want to make sure that you understand the purpose of forest plots and can make a general assumption of what you're looking at because they're crucial. They provide great information, and again, we don't want to miss the statistics within research. We want to make sure that we understand that and we feel comfortable looking at those things. Again, if you have any questions, as always, don't hesitate to ask. Hi guys, I want to walk you through a couple of things for this week's assignments and discussion questions. As you know, we are looking at systematic reviews. So I provided a few things for you. First and foremost, I provided a checklist that you can use. This isn't something that you have to turn in. It's simply a guide, something to help you walk through as you go through the article that I provided for you to complete your review on, and then to help you when you look for your own or search for your own article for the 2 discussion questions. So just to take a look at it, it's fairly simple. It's just asking a few questions, and it gives you a space to kind of recap what you looked at and say yes, no, maybe so, just to get an understanding of what you felt the article provided or what you understood. Sometimes it helps to write out what you're looking at when you're first starting out with research. Well, actually, long term, I still do this actually, just to make sure you're not missing anything when you critically appraise the article. So take a look at this. It's just something very simple. Again, just a guide, nothing that actually is required. But I feel that it will help you to complete your assignment and your discussion questions. Last but not least, at the very bottom, there is a little section here that will provide definitions from some of the things that you're going to look at within this week's readings and assignments and discussion questions. So there is a nice little appendix here for you. Now let's take a look at the actual assignment. So this is the actual outline that you will use to complete the assignment. Essentially what you're going to do is take out my inputted information to explain to you what to do and put your information here and leave the headings. Make sure that this is in APA format, and it, of course, as always, is your best work. Now let's just kind of walk through it a little bit. So as always, you're going to put the clinical question. Again, this is the clinical question that's provided by the article. And again, this is based off the article that I provided. So to complete this assignment, you're not going to go look for another article. You're going to use the article that I gave you. For your discussion questions, you're going to search for your own article. So you're going to provide the clinical question, the rationale for the study, and please note there are 4 points, so make sure to address all 4 points. You're going to, instead of your own search strategy, because we're looking at a systematic review and this was already done, you're going to put the author search strategy. You're going to look at the quality of the studies included, and then 2 new terms that you have and will learn about this week. Here, you're going to discuss those items as well. Just know that there are 2 slide decks provided and a video to help you better understand this information. If you're still unclear about things, as always, do not hesitate to ask me. That's what I'm here for. Next, you're going to include the main findings of the systematic review, provide a synopsis, please note 200 to 300 words, and then you're going to provide implication for patients. What I want you to do here is put this in a context of talking to a patient. As a clinician, how would you explain this to a patient? Is it beneficial to them or is it not, depending on your patient clientele or your specialty? But essentially, make sure that you're explaining this in a way that they can best comprehend. So I would avoid too many technical words. Just make sure that the conversation flows, that you're providing accurate information, but at the same time, it's not above their head. You don't want to overwhelm the patient. You want to be truthful, but you also want to put it in a context that they can understand. Last but not least, as always, please add your references. If you have any questions about anything that I just talked about, do not hesitate to ask.